I'm Dr. John Kempter. I practice in Concord, North Carolina and in Winston-Salem, North Carolina. I've been practicing dentistry since 2008, and I've been a biologically based dental provider since then also. I found out the dangers of mercury fillings on my first day of dental school. I have a background in chemistry and biology from my undergraduate institution, and one of the first things they do in dental school is they have you go and sit and talk about that there is an amalgam controversy. And I guess I'm the type that I do question authority sometimes, and I like to be able to look at the research. And with my background from undergrad, I had questions about what they were telling us. And so from there I just had, for other reasons, affinity for doing other materials. And luckily enough, when I got right out of dental school, I met my mentor, who is Dr. Sharon Reed, who I work with in Winston-Salem, and she is suffering from mercury poisoning even now. And that was when I became aware of the IOMT and safe removal protocol, and almost instantly got involved with it. I had a patient who found me through a doctor that I work with locally, and she had several issues with her health, specifically lethargy and hair loss, and had gained weight, and was just generally not feeling well. And she was at a point where the doctor had mentioned about the mercury in her mouth, and she was unaware of what the metal fillings in her mouth had in them. And through a relationship that I had with him, he sent her to me, and we saw her over the course of 3 visits and took out over 10 metal fillings and did it with our safe removal protocol. And I think the thing for me that was just the best about it was 6 months later, when she came back for her recall visit, her cleaning visit in our office, and I came into the room and I literally didn't even recognize her. Her color was different. Obviously her attitude too, her smile was just the best. She gave me a big hug, said I'd changed her life, and had even written to Dr. Oz about her experience just in my office. And it was motivating. And it's not just her. I've had this situation consistently since I started doing this several years ago. I feel sad. I feel sad that there's this many people that have this material in their mouth, and also that we're still placing it more today than we are composite resin. In terms of what I'm doing specifically in my office, I'm proud of it. I feel a real sense of satisfaction, and I live by golden rule dentistry, I call it. I want what's done on my patients is what I want in my mouth, and I don't want to have anything put in my body that is a known toxin. And so it is. And my staff too. My staff are a lot of. They've had experiences outside of my practice. We're a young practice. I've only been a dentist since 2008. So a lot of my staff have had a lot more experience than me, and I think it's really neat seeing them now, several years into this really new way of thinking for them. And I've had several of them come to me concerned about their mercury levels occupationally, and so it's nice to see that they see the issue also, and what we're doing. One thing that I think separates us from a lot of offices is my perspective of a biologically based practice. I have it's whole body dentistry. We're not just focused on filling your teeth. We're not just focused on fixing the way something looks. We want to make sure that we're putting you in a spot where you're going to have a healthier life, a healthier mouth. And I think the other part of that is I'm cutting edge, and I use that cliche, but I'm a digital dentist. I use 3-dimensional x-rays, and I have a machine that can fabricate crowns in office, so that for patients, especially that don't want to be at the dentist, they can come and get their work done in one visit. And that's definitely not in my area outside of Charlotte. It's pretty rare. People should see their value in their teeth because it is connected to your whole body. And I always explain to my patients that we have more nerves in our mouth and right above our mouth than anywhere else in the body. And what we do, what we put in our mouths, and what we, not only materials, but also obviously what we eat, has a systemic effect. And one of the things we, in medicine, in the United States especially, we miss is that, you know, we have where the mouth is not part of the body. You know, dentistry is considered its own field. It's not part of medical care, and that's completely false. In fact, it's it really is the reason why we're in the spot we're in. And I feel that if patients were aware of how much things were interconnected, they would be way more concerned about it. I know a lot of people that have been, you know, that feel that dentistry is a factory-based field, you know, that they feel like cattle. I've worked in practices like that, and what I learned is what I don't want to do. What I want is patients to have that individual time and to feel like, you know, it is all about them. That's my vision, and I tell my staff all the time that every patient, everything we do with patients is a touch, and we want to be able to have personal relationships. It even comes down to the name of my business. It's Kempter Family Dentistry, and what I really want is I want a family of patients, and to me, my family is the most important people in my life. And you know, it's like when you get a membership card in my practice, you come and you get your exam, and you get to meet me, and I feel like I'm invested. You're invested in me. I'm invested in you.